have patients that sometimes have drains that are placed in cavities where we've taken out implants, or in our tummy tuck patients that we need to evacuate some fluid. So I want to show you really in our practice how we like our patients to take care of the drains. It may not be for very long, but at least this way what we're doing is preventing blood collection in a space that potentially requires us to go back to surgery. So I want to show you a little bit about what a drain is and what that means. Our patient here had surgery to remove implants and to have the space evacuated where those implants were placed. This is what drains may look like after one day. She's 1 day post-op. It can look bloody. It does have a color to it that is liquidy, almost like Kool-Aid. But what we're trying to do is prevent clots from staying in our drain. If you focus in right here, you can see where there might be might be a little clot right there in the drain. So what we want to do when we say strip a drain is to grab and pinch close to the edge of where it enters the skin. And we have a little alcohol wipe here. You pinch and you strip. And so that evacuates that little clot, and we're hoping to have that drive itself down into the receptacle. And so you do that a couple times every 4 hours or so, just to kind of keep that area open. The drain inside the body is a channel drain, so it will collapse as there is a suction on this. Now, something else to kind of consider also is when this thing needs to be emptied, you can see there's a volume on here, and we want you to measure that in a little cup or a little medicine cup that has a measurement on there, and you can record that every 12 hours, 4 to 6 hours, and you can see that right there. We can have you measure this into a drain. And record that. And then you can spill it down the toilet. And we'll do the same thing. We'll just collapse the bulb and close it. So that's really it for a drain care. Hopefully these drains don't typically stay in very long. At most, we see them in our tummy tuck patients for about a week to 10 days. Certainly patients that have breast reduction, it's very common to have drains. Any implant removal or breast lift procedures that have a lot of space that we have to evacuate might keep drains in for about 4 days. But in our practice, we'd like you to be able to take care of the drains in a way that we can prevent any complications.